Health this morning. It's been more than 40 years now since the very first case of HIV reported in the U.S. And now a new treatment only requires 2 injections a year. Cleve Jones is co-founder of the San Francisco AIDS Foundation and joins us live now this morning. Cleve, good morning. Thanks for being with us today.
Good morning. Thanks for having me.
You bet. So HIV first discovered in the U.S. back in 1981. For those who may not know, remind us of the basics of the virus. How does it affect the body and who's at risk?
Sure. AIDS stands for Acquired Immune Deficiency Syndrome. And this is a set of opportunistic infections that happens when the immune system is destroyed by a virus that we call HIV, the human immunodeficiency virus. It can take years to take hold, but it gradually destroys our immune systems, leaving us vulnerable to a whole host of these infections that ultimately kill people. So I've been part of this struggle since the very beginning, since before the disease even had a name. And one thing that people have to understand is that despite all the years of work and research and advocacy and care, we still do not have either a vaccine or a cure. What we do have, though, is the knowledge that treatment equals prevention. So what has happened is a real important focus across the globe to make sure that people have access to the life-saving treatments that not only keep people who have already acquired the virus alive and healthy and thriving and able to work and support their families, but also it prevents transmission of the virus. So the single most important thing we can do right now is to make sure that treatment is available to all the people at risk of getting HIV across the world. And that, of course, is millions of people. AIDS never went away. The virus never went away. And it's ready to come roaring back if we don't do our jobs right.
All right. Well, when was the first time that you guys were, your organization was created? When did that happen?
Most of the HIV/AIDS organizations started in the period around 1982, 83, 84. Here in San Francisco, that's when what is now called the San Francisco AIDS Foundation was started by Dr. Marcus Conant from UCSF and Dr. Paul Volberding from San Francisco General Hospital. You see Dr. Conant there examining one of the early patients. There's Dr. Volberding. There was also strong support from the affected communities, of course. But we still tend to think of HIV/AIDS as a particularly American a malady affecting primarily gay people, and that's just simply not true. From the very beginning, HIV has been a threat to every demographic.
So we know African Americans and Hispanic Americans, though, are disproportionately affected by HIV. So what are the different factors that play into that, and what kind of work does your group do now to address that?
Well, first of all, it's not my group. It's the San Francisco AIDS Foundation. I'm proud to say I was one of the co-founders. Our organization is led today by Dr. Tyler Termeer, himself a Black gay man living with HIV who knows very well from his own personal experience what some of these challenges are. But you know, Joey, we saw the same thing play out in COVID. The racial divide is very, very real, and the outcomes are very different based on race. And that is just simply a sad reality. But as with HIV/AIDS during COVID, we saw that Black and brown people were more likely to get infected, more likely to be hospitalized, less likely to access the life-saving treatments, and more likely to die. So this has been a reality of facing public health people for a very, very long time. But I think it's really important for people to understand that's part of why this new drug from Gilead Sciences, based in Foster City here in the Bay Area, is so critically important. I mean, I cannot overstate the significance of this development, because instead of a complicated regimen of taking multiple pills every day, jumping through all sorts of administrative and bureaucratic hoops, frequent testing, we now have a formulation that with just 2 sets of injections a year will prevent people from acquiring the virus. And the stats on it are really remarkable. The efficacy is just undisputable. It's very, very big deal. But it's only going to work if we can break down all of the barriers to accessing this treatment in our own country and worldwide.
Do we know yet how effective this is and who's best suited for it?
you know, you can never say that something is 100% effective, but this is pretty darn close and safe. It works. So, and we, you know, for your viewers who may not have been following the science, this is called PrEP, pre-exposure prophylaxis. And it's not a vaccine, because a vaccine trains our body's immune systems to identify specific pathogens and attack and destroy them. That's not what this is. This is a treatment that suppresses the virus or prevents it from taking hold within our immune systems. But it works. It prevents transmission. It keeps people from getting sick. It has to be made available. And what we're seeing right now is really kind of an awful irony, that at the very moment that the world is on the brink of really getting to zero, the potential of getting to zero new infections instead of over 1 million a year, instead, we're on the precipice of an entire new wave of HIV/AIDS infections as treatment becomes less accessible due to shifting priorities. And I'm talking, of course, about the United States the administration's decision to go after these foreign aid programs that make it available throughout the world, and also here at home, the threats to Medicaid, to public health policy. All of this has a very direct and urgent impact on our ability to make this medication available.
All right, Cleve, from the San Francisco AIDS Foundation, such an important topic to be talking about this morning. We appreciate your time. Thank you.
Thank you.